Hello, everyone. Thank you so much for joining us this afternoon. I'm Dr. Jaquiba Henderson, Senior Vice President of Maternal Child Health Impact and Deputy Medical Officer here at March of Dimes. I want to welcome you all to this special episode of our monthly Healthy Moms, Strong Babies series. Today, we're celebrating neonatal intensive care graduates, their families, and their care providers. Approximately 450,000 babies are admitted to a neonatal intensive care unit, or NICU as most people call it, each year in the United States, with problems ranging from prematurity, birth defects, infections, cardiac malformations, and surgical problems. When a baby is born sick or too soon, the NICU team of specially trained healthcare professionals has a critical role in influencing how that plays out. The babies may be small, but there are many healthcare professionals involved in their care, including neonatologists or physicians who specialize in caring for newborns, neonatal nurse practitioners with advanced training in pediatrics and certification in the care of sick newborn infants, consulting physicians with specialized training in other areas of pediatric medicine, such as cardiology, infectious disease, and surgery. There are respiratory therapists, developmental, occupational, and physical therapists, dietitians, lactation consultants, speech therapists, case managers, social workers, family support coordinators, and more. And often it's the baby's neonatal nurses coordinating all of these important aspects of their care. Neonatal nurses are trained to work with newborns born with a variety of problems. They use specialized medical equipment to monitor vital signs and maintain a baby's body temperature, breathing, and nutrition. They also perform tests and deliver medications, treatments, and care to help the baby get better. Many times these newborns are sick for months, and neonatal nurses care for them from the time of birth until they're discharged from the hospital. They also educate parents and help them through this incredibly difficult time. This week is Neonatal Nurses Week. And on behalf of March of Dimes, I'm thrilled to recognize these fantastic healthcare professionals who provide NICU babies and their families with the best possible care in their most vulnerable moments. At March of Dimes, we have created a wall of thanks to show appreciation for NICU nurses. If you'd like to add a note, you will see the link in the chat on our resource slide at the end of this webinar. September is also the 20th anniversary of our March of Dimes NICU Family Support Program. We developed this program to help support NICU families during their baby's time in the NICU. And the program also educates NICU staff about the best ways to support babies, families, and each other. We are so very proud to celebrate 2 decades of helping families and babies. We will now show you a video that we'd like to share in observation of this special 20th anniversary.
March of Dimes serves as a trusted partner for hospitals across the country to educate and support families with a baby in the NICU and during their transition home. Considered the premier program for NICUs, our NICU Family Support Program offers family education, staff training on family-centered care, and an improved patient experience with the support of March of Dimes experts. As we mark the program's 20th anniversary this year, we celebrate our hospital partners that have helped us learn and grow. With their support, we now reach more than 50,000 families a year through our in-person and online programs and complementary resources like the My NICU Baby app, which provides answers to common NICU questions, and interactive tracking tools and community support in English and Spanish. We'd love to hear from you and discuss how we can work together to bring valuable resources to NICU families in your hospital. Visit marchofdimes.org/NICU Family Support.
For the NICU families that are out there, being in the NICU can feel overwhelming, but you are not alone. We have digital resources that we will share today that can connect you with other families with similar experiences to offer support and tools to help you navigate your journey. Today, we are happy to be joined by NICU professionals, a NICU graduate, and a mom who will be sharing their stories and answering your questions. If you have questions or experiences of your own that you would like to share, please feel free to share them in the comments section. So let's get started. First, I'd like to introduce you to our amazing panelists. They each have unique experiences and expertise in the NICU that they're bringing to today's conversation. Our first panelist is Carissa McLaurin, who is a senior research associate at Yale University and the mother of a 4-year-old NICU graduate. Carissa's story began with pregnancy complications and an emergency cesarean section at 27 weeks gestation. That's about 3 months early. Carissa's son, James Jr., or JC, was born weighing just 1 pound and 6 ounces. JC spent his first 5 months in the NICU, facing many medical challenges. During that time, Carissa and her husband received support from the Yale New Haven NICU staff and the March of Dimes NICU Family Support Program. Today, JC is doing well, and Carissa and her family serve as a March of Dimes ambassador family. Our next panelist is Dr. Alan Piccarillo. He is the medical director of the Division of Neonatology at the Barbara Bush Children's Hospital of Maine Medical Center. He has been a physician for over 20 years and board certified in neonatal and perinatal medicine for more than 15 years. He is skilled in NICU care, clinical research, and medical education, and is passionate about patient safety, process improvement, and family-centered care. Our next guest is Christina Lloyd, who is a practicing NICU nurse and the NICU Family Support Program coordinator from Virginia. She has a master's degree in community health nursing. She has also worked as a nurse consultant, creating and implementing a variety of health coaching programs on perinatal health. She has interviewed hundreds of families about birth experiences for an NIH-funded grant, and she is a faculty member for the March of Dimes Training Institute. And our final guest is Lauren Larosa. Lauren is a former preemie, born in 2002 in Greenville, South Carolina, More than 3 months early, Lauren weighed in at just 1 pound, 7 ounces. She had a difficult start in life. Her first 89 days were spent in the NICU. She was dependent on a ventilator for the first 6 weeks of her life and required oxygen support for more than a year. Lauren's family was one of the first to receive support from our NICU Family Support Program. Over the years, Lauren maintained a bond with Rachel Balk, the NICU Family Support Program coordinator, who provided support to her family during their NICU stay. Today, Lauren is a healthy 19-year-old sophomore at the University of South Carolina Honors College. She volunteers with Rachel's program and is studying to become a NICU nurse. Wow, that is so amazing, Lauren. I'm going to moderate our discussion today and ask each of our panelists a few questions specific to their area of experience, but I encourage all of them to weigh in throughout the conversation. I also want to invite everyone joining us for the webinar to use the comment section to send us your questions, and we'll do our best to address them throughout the presentation. We'll provide helpful resources as well and links during the call via the comments section as our conversation progresses. So I'm going to get us started, and remember, please, to keep those questions coming in our comments section. First, I'd like to welcome Carissa. Thank you so much for joining us today. Could you please share more about what your experience was like being a parent in the NICU?
Thank you so much for providing me this opportunity. My experience in the NICU was it was an emotional roller coaster. For those 5 months, it felt like I had the wind knocked out of me, hit in my stomach and had the wind knocked out of me. My emotions range from hopeless, happy, sad, depressed, confused. And it was a very, very, very challenging time for myself and my husband. Throughout our stay, we would meet with the NICU team, the doctors, the nurses, and just discuss my child's care. And what we did was, by month 2, we decided we should start to dress up his isolette for the seasons and the different holidays. And the nurses actually participated in that as well. And with the help from the March of Dimes family support at Yale New Haven Hospital, I felt helped out my family extremely. And I thank you guys so much.
Oh, that's fantastic. I'd love to hear how you decorated the isolette. Some people may not be familiar about what an isolette is. Can you describe what that is
An
and how you
isolette,
were able to decorate it?
sorry, it's where they keep the small infants and to monitor their temperature. And it's also called an incubator.
Thank you so much. That's an amazing way to celebrate your baby in the NICU. We're so glad to hear that JC is doing well and exceeding all of his milestones. And looking back, what's one thing that you wish that more people knew about being in the NICU?
I wish more people knew about March of Dimes and the family support they have at Yale New Haven Hospital that I did not find out until 6 weeks after we were in the NICU, that there was actually a support person there for the March of Dimes. And with that, we learned about the outreach that they had, the resources they had for our family. And we also met other families whose babies graduated, and just got to meet these families, speak with these families because they went through it. And we were able to listen to their lived experiences, and they provided us a lot of support as well.
That's fantastic. I'm so happy that you received that support during such a very difficult time. I know in addition to the NICU support staff that, I'm sure you interacted with a lot of the medical professionals taking care of your baby. And how impactful were the NICU nurses and the professionals in the NICU during your time in the unit?
They were very, very impactful. And actually 4 years later, we still keep in contact with our NICU nurses, as well as the providers, as well as our family support person. And they actually helped out a lot and made that stay somewhat easier, because it wasn't an easy stay, but we advocated and spoke up when we did not understand things. And when we felt like something was going unnoticed, and they listened to us.
That's fantastic. So Dr. Piccarillo, thank you so much for joining today's panel. And I know stories like this are what drives you in this such rewarding and impactful work. And I would love to hear your perspective as a neonatologist and the director of a NICU. What does your typical day look like?
Kiva, thanks. And thanks to March of Dimes for pulling this panel together today. I wish I could say it looks just like the hospital TV shows. It doesn't. But at times, from time to time, it can be fairly fast-paced. Our typical days are filled with examining infants, meeting with our families and sitting down and getting to know them, because the length of stay can be so long, and meeting with our entire professional staff in the NICU to come up with plans for the day. The specialty does have some hard days, unfortunately, and it's tough that we can't always promise that we'll hand over a healthy baby to the families at the end of the hospitalization. But I'll tell you, the babies are incredible. They have healing powers like no one else in creation. And that's really what drove a lot of us, not only to the field of pediatrics, but to neonatology, because the babies are just so incredible.
I have great respect for the work of neonatologists, Dr. Piccarillo. As you all may or may not know, I'm an obstetrician gynecologist, and often, we try to do our best to keep the babies in and deliver healthy babies, but often that is not the case. And it is such a wonderful thing to have neonatologists as partners to take up the mantle once these very vulnerable infants are born. And neonatal nurses are very crucial to the care that's provided in a NICU. And I'd just like to hear your perspective about how crucial the support is that neonatal nurses provide to your work and to the health of babies.
Yeah, the NICUs wouldn't function without them. I mean, that's the short version. But I mean, the nurses are incredible professionals. And I think of reflecting on what Carissa was just saying, that the nurses are there with the families through thick and thin and form these incredible lifelong bonds with the families. And it's wonderful. And with the rest of the interprofessional group and multidisciplinary group in the nursery, the nurses allow the care plans to continue. to continue safely. Again, in a very unstable baby, I can just imagine how many different jobs the nurses perform all at once, and incredibly professionally, reliably, and always incredibly safely. So again, I don't think we could ever exist without the incredible professionalism of our nurses at the bedside and the entire professional staff at the NICU.
That is fantastic. And I would imagine that they also play a role in providing support as well. Do nurses participate in this NICU's family support program, or are there ways they provide support to families as well outside of the clinical care that they provide?
Definitely. I mean, the nurses provide an immense amount of emotional support, but also can be a great linkage to the NICU family support programs and linking our families up with our support specialists. You know, we all talk about family-centered care, and it can mean different things to different units, but I know where I've worked, it truly is embedded within the culture. And in the NICU family support program, which I've been lucky, it's been at all 3 NICUs that I've worked in, really allows that to continue unabated.
That's fantastic. So I want to ask you one more question. So what are the top questions that parents should ask of their NICU team?
Yeah, so I think the first question is, how can they be involved in the care? We really truly want parents to be involved from the beginning. We tell families they're part of the care team. Now, it doesn't seem like a very preterm baby that families could be participating in the care, but they can. Just by providing hands-on care as a second pair of hands when the nurses are weighing the baby, for example, helping change a diaper, they can be involved from day one, because the more the families participate in the care, the easier transition it will be for when time comes to go home.
That is fantastic. So my next set of questions is for Christina. Christina, thank you so much for joining us today. You are both a neonatal nurse and a NICU family support coordinator. So we are doubly celebrating you this week.
I mean, huge shoes to represent both types of incredible professionals here. So I'll try my best.
Oh, thank you so much for all that you do for our babies and their families. So being in the NICU can be so scary and intense for families. And as a nurse, can you talk about what types of support you provide, what types of support that they need during their NICU stay?
Sure. So as a bedside nurse, of course, my primary responsibility that day is the clinical care of the baby, both in terms of what I'm doing in that moment and how what I'm doing in that moment may or may not affect their long-term outcome. But what I have come to realize, and what I try to impart on everybody that, I come across in the NICU world, is how closely the families and the caregivers' well-being and participation, as Dr. Piccarillo mentioned, in the whole NICU experience, how closely they do affect how the baby does and how the baby transitions to hopefully home. So, we support the families primarily through lots of education, both in how to care for their baby, if their baby is really tiny, if I need mom or dad to help me with pain control during a, say, IV start or something, if also the education on how, if baby's breathing too fast, how we need to take feeding slower, whatever it is. So lots of education, but it could also just be that shoulder to cry on that day too, just to process emotion or to process what's going on with that family that day. I mean, we are, most of us work 12-hour shifts. So we are with these families for 12 hours at a time. And certainly, lots of different things can happen in that one day, let alone if you're with a family 2 or 3 days that week. So lots of good stuff.
That's fantastic. I can imagine it being so anxiety provoking for families thinking about what to do once they take their babies home, when they don't have you there 12-hour shifts at a time to support them. So what things do you do to support? I know you mentioned education, but what things do you do to support families with babies in the NICU in making that transition? Is that part of the support that's provided through the NICU family support program? Can you tell me a little bit more about that?
Sure. Yeah, we do a lot of things like classes, for example. We also have lots of written material. on transition, well, virtually every aspect of NICU care, but especially on the transition home. We link families to other resources outside of the NICU, and that can be follow-up clinics or even our other NICU families who have gone through similar experiences. So all of these things, we try to, link this all full circle for families. We also provide information through digital information through apps, and the My NICU Baby app is a real big one, available to any NICU family, even if your particular hospital that your baby is at is not affiliated with a specific March of Dimes NICU family support program, which comes with a bunch of fun things to do, like filters and tracking for skin to skin time, or pumping time, all those good things you can do with your baby. But then lots of also videos and written information about how to care for your baby once you're at home without that bedside nurse helping you along the way.
Thank you. Thank you so much for highlighting those key resources for families. And I just want to direct participants to the comment section. There should be a link to some of these resources, particularly the NICU Family Support, the NICU Baby app. That My NICU Baby app is a great resource for families. Thank you so much, Christina.
Yeah.
So Lauren, it's so good to see you. Your story is particularly impactful because you were a NICU baby yourself, and one of the first March of Dimes NICU Family Support program. How do you think that experience influenced who you are today? I don't know if you know, but how do you believe it impacted?
Yeah, first off, thank you so much for having me. I'm so excited to be a part of this panel. I think for me, March of Dimes really introduced my family to the type of support that goes beyond the bedside. So this is the type of support that, there's different resources that March of Dimes can connect you with that are outside of the hospital, different ways you can get involved, things that just go beyond the critical care in the hospital. It's just something that's so inspiring to me. And I think that really showed me how much March of Dimes and how much the NICU cared for my family. And it really inspired me to then want to show that care and be there for other families who are going through similar circumstances like what mine was.
That is wonderful. And that is such a huge impact 20 years later. So I know you're still in contact with the NICU Family Support Program Coordinator who provided support to you and your family. How has she affected you and your family?
Rachel has been there since day one, obviously, and she has been here until now. She's been with my family every single step of the way. Honestly, she's been such an inspiration, so supportive. She was able to connect my family with different families while I was in the NICU that shared similar stories with mine. So that way my family was supported by not only March Dimes, but other families who have gone through the same thing as us. And then she was able to connect us with, different opportunities that we could do through March of Dimes, whether that be different fundraising or service events, things that help us stay connected to the program, and that things that also make us or help us provide support to other families as well. And then in my senior year of high school, I was able to actually volunteer with Rachel and work in the unit in Greenville, the same unit that I was born in. And that was such a unique experience. I was able to see firsthand how the nurses and doctors work in the NICU and how specifically March Dimes Family Support operates, which was such an amazing experience. And I'm truly grateful for that. I honestly would say that Rachel is not only a mentor, but a friend to our family as well.
What an amazing story, and what beautiful relationships that came out of your experience as a NICU graduate. And I understand that you are wanting to pursue a future career as a NICU nurse. Can you tell us what inspired that future career choice?
Yeah, so I pretty much always knew in my heart that I wanted to do something with healthcare, specifically related to the NICU, just from the stories that my parents would tell me about how amazing the NICU was and how amazing Marcia Dimes was throughout the entire process. And then really being able to do that volunteer work with Rachel. When I was in the unit, I was able to see the babies, see how nurses were able to care for those babies, just really solidified that dream for me. And I'm so excited to be able to say that I'm pursuing a career in that direction.
That is absolutely fantastic. So I'm going to open up some more general questions that anyone, please feel free to jump right in and answer. Do you all have any advice for families who are getting ready to go home from the NICU, who are going through the experience right now?
I would say kind of what we've already brought up, like get involved with every little bit of your baby's care. And, don't see it as an all or nothing. These things are, they grow and they build upon themselves. So maybe today, if your baby is really tiny or unstable, it's just putting your hands on that baby. And then maybe tomorrow it's taking a temperature. And then maybe the next day it's changing a diaper. And then one day giving a bath and changing clothes. These things build and build and build, whether you're in the NICU for 1 week or 6 months, we can always be building on and it's those families that really, take good care of themselves and each other, but then also, get in the NICU and get their hands on that baby as soon as possible and do what they can with the nurses to provide the care that ultimately I see, at least in my unit, be prepared to take home their baby.
Yes. And Carissa, do you have any advice for families and friends of someone who has a baby in a NICU? I know experiencing it firsthand as a parent that you may have some advice in that area as well.
The advice I have for parents is take time for yourself. And if you need help, ask for help. And if things get too rough, there's always somebody out there to help you with anything you need help with. Mm-hmm. For the friends, don't ask when the baby is coming home. If the parents knew when their baby was coming home, believe you me, they would scream through the rooftop the date that their child is coming home. So you could just come to the house, offer to cook dinner. If they have children, babysit, help clean up, just be there for them. And they will eventually let you know what's going on. And to the parents, to the parents whose children are still in the NICU, this journey is not a sprint, it's a marathon. Your child will come home when it's the right time for them to come home. Don't rush it, it'll eventually happen.
That is wonderful advice. I know that this is, hard for a lot of families being separated from their infants, being in the NICU. I can even imagine with, during these particularly trying times with this pandemic, how it's been a challenge with the NICUs having to limit the number of people who can come in and other precautions that are being taken because of the COVID-19 pandemic to protect these fragile infants. I'm interested, Dr. Piccarillo, are there any additional precautions that parents should take with their premature babies during the COVID-19 pandemic?
Sure. I think, there's the typical public health measures that come to mind would be, vaccinate all eligible family members. Don't visit if you're feeling unwell. If you have any concerns, your NICU nurse is the best person to call, and they'll give you, steer you in the right direction and give you the right advice. And then I think the last piece is probably what we learned in kindergarten is wash your hands.
Yes. And stop kissing on these babies. That's my little piece of advice to add to that. Even if you are vaccinated and you're feeling well and you've washed your hands, stop it. Keep your lips away from the babies. Christina, so you've interviewed hundreds of families about birth experiences and trauma. And what have you learned about reducing the trauma of an unexpected birth experience?
Yeah. It really varies, from family to family, what one family finds traumatic in the experience and what another family does. Certainly some of the reoccurring themes we hear is the whole when you are discharged, but your baby has to stay behind. It's very, very hard for families. So, you know, knowing that that's coming when mom is going to be discharged, usually before the baby is. And likewise, if there are any setbacks for the baby, if the baby needs a blood transfusion or whatever it is, those are hard days. So just giving some extra listening ears and support and seeing what helps that family. You know, I would always direct families to start with the basics. I think kind of what I've heard here too is let people care on you and love on you. Take care of yourself. You know, no new parent is going to be getting great sleep, but try to make some sleep and rest a priority. Your own nutrition and hydration, all those things. I tell families, you cannot neglect those things when you have a baby in the NICU. If the mom is providing breast milk, I need you to do those things so I get that milk for the baby. If you know, it also helps the families be more, you know, when they are rested, it helps education and decision making to happen easier. So start with those basic things. And then from there, like I said before, just get your hands on the baby, ask the nurse, ask the doctor, ask the physical therapist, ask the you know, case manager, what can you be doing for your baby right now? And just keep getting involved in the care, keep getting that education, and keep building on those skills. And then enjoy some of the fun things that hopefully the staff is providing around decorating the isolette, or, you know, if Halloween is coming up, we do cute little layover costumes for our babies to dress them up in their first little costume. You know, those sorts of things, you know, although they may just seem like a nice thing to do at the time, or they really, really mean something to families who are spending those holidays in the NICU. So enjoy those little things too, and make what is sometimes a very abnormal situation a little more normal by enjoying those things.
That's some great advice. Great advice. So it looks like we have some questions from those who are watching on Facebook. The first question I just want to send is, wait, before I give the question, I just have to give a special shout out. Someone sent a special shout out to Carissa, and it says, sending virtual hugs to you from Connecticut. I think that's beautiful. Also from Facebook, how has COVID-19 impacted NICU stays? What are the biggest challenges? Anyone want to take a stab?
Yeah, I can contribute a little bit. I think it's been really difficult from a visitation standpoint, depending upon what's going on in the local community, the local state, or with the specific hospital rules surrounding visitation. I can't imagine the additional stress that puts on families in an already fairly stressful situations. And we're hearing wonderful anecdotal stories of how some NICUs are using, you know, virtual rounds via video technology. It's not the same as having the families in the room, but it at least allows for a little better free flow of information with families. And really, hospitals getting incredibly creative around visitation. Those are some of the wonderful things that we've been hearing.
That's wonderful. I'm sorry, Carissa, I messed up your shout out. I didn't tell you who it was from. It's from Kara Preston. And I'm sure, is Kara someone you know?
Yeah, I think she's from the March of Dimes, Connecticut.
Oh, that's fantastic. So we have another question. Are there mental health resources available to families specifically?
I would say to definitely, you know, check out the, again, the My NICU Baby app. There's a whole great little class on there about caring for you and mental health, especially during a NICU stay. I would say to ask the staff at your local hospital, because oftentimes there are resources locally, whether it's a parent-to-parent support. NICUs sometimes have mental health professionals in their NICU. So ask whether it's the nurse, social worker, case manager, you know, or a charge nurse making rounds, whoever it is, ask specifically in your area. Sometimes it also varies state by state. Sometimes Sometimes there's, bigger programs, state by state. I know in Virginia here, we have some great mental health resources, including virtual parent-to-parent support for parents who find themselves in the NICU. We have a virtual NICU family support Zoom call twice a month. So just keep asking, and hopefully that gets you in the right direction to get started.
Fantastic. So Lauren, there was a special shout out for you as well. Meredith Goodwin Repick says, great to see you, Lauren. I'm in South Carolina and was with the March of Dimes when we opened the NICU Family Support Program in Greenville. I also helped get the sibling room created there. I also have a question for you, Lauren. Are you learning about support systems in nursing school? For people considering a career in maternal infant health, what do you think they need to learn before entering the field?
Yeah, so I've had a few different classes that have kind of gone in depth into how nurses can provide support and how they can initiate a bond of trust and a relationship between a nurse and patient. And that's been a really great experience. And I've also been fortunate enough to actually work on research with the Honors College here at the University of South Carolina. And I've been able to do research on nurse practitioners and specifically how they're able to provide better patient-provider communication and support when delivering news in a critical setting. So that has been a lot of fun. I've been enjoying learning about that. I think for people who are interested in going into healthcare, specifically into maternal infant care, I think the best way is to get involved, try and find things that you can do now before getting into nursing school or into medical school that will kind of expose you to how the NICU works or how the hospital works. This could be things from doing a hospital drive where you collect clothes or blankets that you're able to give to the hospital, or finding ways to volunteer, I think is another great way to just find a way to get involved and see how nurses and doctors are able to care for patients.
Fantastic. I have another question that has come from Facebook for Christina. How do you use parent graduates as advisors?
Yes, we definitely do. And we've used them in a couple of ways. We have a NICU parent advisory committee at my hospital that I work at, and they provide a lot of the parent-to-parent support to our current NICU families, whether that's in-person support, whether that's developing, little holiday giveaways. They like to really support the families that are currently in the NICU. They also did an entire spread this week for NICU Nurses Week for the nurses. So they just like to really give back to the NICU. We do also utilize them in actual, work that happens in the NICU, whether it's around policy development or committee work. I highly encourage everyone who works in a NICU to review your patient information, your signage in your NICU once a year, and take a former parent with you, because how you see it, especially in the day-to-day, is sometimes very different than how somebody who doesn't, hasn't been in there and doesn't live this world day-to-day, sometimes how they see it. So I have used families for that way. We moved into a private room NICU from a pod style NICU about a year ago. And we absolutely used family advisors to help develop that room. Where should we put the patient, the family care area, the breast milk refrigerator, the TV, the safe? We developed our rooms very much with the families in mind. So we had their input. We had them test out different chairs, which one felt better in the skin to skin positions and stuff. So I've used them in a variety of ways, and it's been a real collaborative process.
That's fantastic. So we have some questions that are coming in. Before going to those questions, I actually have a question for Dr. Piccarillo. I hate to put you on the spot, but I know that you have been deeply engaged in work for improving the quality of care provided in a NICU. And I'm interested in hearing about how that has impacted just the care that's provided in a NICU and how parents and families can be engaged in that work.
Yeah, Kiva, thanks. That's a really great question. So like most areas in medicine, we engage in continuous quality improvement. About a decade ago, in partnership with other NICUs around the country and with the Vermont Oxford Network, we realized having families as part of those quality improvement teams was, you couldn't do it without them. And every single project that PACEs have started to run now has a family member. One of our big projects at my hospital is creating a small baby program, or a area within the NICU where tiny babies are cared for. And we have a very, very vibrant parental participation in it to let us know things, again, that Christina just said, that we don't ordinarily see because we may just pass by it. But the families point out very glaring, obvious things that we may be missing. And it allows us, when we get to the final product, we have something that's really finished, rather than presenting a half-finished product to a family, then realizing we made some big mistakes and have to start again. So having the parental perspective there from the beginning in a quality improvement project is paramount, and it's a necessary part of any QI team in a NICU.
Thank you so much, Dr. Piccarillo. And let me see, we have some questions I think I'm going to pick here. Oh, this is a great question. So do you have NICU reunions, and how do those make you feel about the work that you do? And then also, as part of that question, is whether Carissa and Lauren have ever participated in a NICU reunion.
Yeah, I know for Greenville, there are reunions that they have every year. And my family and we went to them for a few years, and they were great, and it was wonderful. We got to reconnect with people that we met in the NICU, whether that be families or doctors or nurses. And also we got to see March of Dimes again, which was always a fun time. And then I have also, in the past few years, have volunteered and helped out with the NICU reunions as well, which is also so great because I get to kind of experience that from a different angle, which is always such a great opportunity. And I really love the NICU reunions, just to see everyone get together and to celebrate their babies and how far they have come. It's really inspiring.
That's wonderful. And I'm a little hesitant to ask the next question, because the next question is actually for me, but I'm going to go ahead and answer it. The question is, what is March of Dimes doing to reduce preventable preterm birth? That's a big question, but I can answer that question. And there are 4 main areas that March of Dimes works in to improve care and outcomes for moms and babies. And that includes research, that includes education. It also includes programs and in advocacy. And in all of those 4 areas, we have various activities that are working to reduce preventable preterm birth. One such example in the area of programs, we have a program that is built around the group prenatal care, pushing the group prenatal care model, which has shown evidence, particularly in reducing preterm births among high risk and vulnerable groups, particularly among Black women who are at particularly high risk for preterm birth. And that program is called our Supportive Pregnancy Care Program. We also support advocacy, so policies that include allowing women to have access to the best care possible throughout their pregnancy and beyond, including extending Medicaid coverage for women and families. We also have educational efforts around helping to educate providers and patients about the best way to improve their health. And then research, we support and provide funding for various research efforts, including our prematurity research centers, and looking for innovative ways and treatments to prevent and to treat preterm birth. So those are just some of the areas that March of Dimes is working. You can also go to our webpage to find more information about some of those various programs and efforts. And I'm also excited about some of our more recent efforts, including our Mom and Baby Action Network, where we're working with various partners to push systems level change to help improve outcomes for moms and babies. So I hope I answered that question satisfactorily. And then there's another shout out from Facebook from Janelle Bainter. who says to Dr. Piccarillo, big shout out to Dr. Piccarillo. I'm the March of Dimes program coordinator at the Barbara Bush Children's Hospital and Maine Medical Center. And he is a tremendous champion for babies and families and meeting their unique needs. He's the best. So a nice endorsement for Dr. Piccarillo as well. And then we have another question for the group. How can NICU staff who are doing this work care for themselves when doing this high pressure, stressful work? This may be a good quick question for you, Christina, since you are a NICU professional and as a NICU nurse and as a NICU support person.
Yeah, that's a tough one. I wish I
and
had.
For you,
I wish I had
Dr. Piccarillo as a physician who cares for babies.
I wish I had a really good succinct answer to that one. I mean, definitely support from the community, especially during these last 18 months, but always, whether it's through a NICU Parent Advisory Council or a reunion, it does mean the world. So, just to see that, definitely, just taking time, as much as we live and breathe and love the NICU, taking time away is huge. You come back refreshed for sure. Supporting each other. I have always felt very, that my work colleagues become my family for sure, because nobody else quite understands your day the way they do. So getting support from people who understand. And obviously support from the top, both the March of Dimes and our own hospital administration has been so supportive in terms of just meeting the needs of the staff, whether it's a debrief after a particularly stressful situation, whether it's bringing in ancillary resources from social workers or chaplains or anything else to help kind of go through a time that was tough. And then again, just taking time away too, so that you can come back and do it again and again.
And I think just adding to that, just celebrating the victories. Yes. So whether it's a year of no central line infections or months of no unplanned extubations, I think celebrating these mini victories, and every day is a victory. We're able to send a baby home with a family. And I think we always need to remember that, but relying on the celebrations, mini celebrations are really important too.
That's very, very good points. Very good points about, and also the importance of making sure you take care of yourselves in the process of caring for others, because you can't pour out of an empty cup. And one of those things that I think is tough in taking care of sick babies, but also I know from my perspective, taking care of sick moms. These tend to be people that you expect to be healthy and vibrant. And some of the most challenging times is dealing with the times when we have losses. And I know we haven't really talked much about that, but I'd be interested in hearing on how families are supported when you know that a baby is not doing well, won't do well, or when you have to give the news that a baby has lost its fight.
Yep, all tough situations, and most hospitals do have a set of nurses who run bereavement committees to make sure processes are in place for when these situations arrive. And even we have used, I have been in the past used, you talked about using families as advisors, families who have experienced a loss to come back and tell us what was super helpful for them. And, what little words or what little things did staff do to make that incredibly horrible situation just a little bit better. And we make sure to educate everybody on that. And that is also something that, and this kind of dovetails on what we're just talking about, caring for nurses and physicians and all caregivers, is part of the NICU family support program is to educate families, but also we have a lot of education for staff around bereavement, around also we have one specifically called caring for the caregiver. So just making sure that the staff in the NICU family support hospitals in the world have these access to these resources to make sure that they know that there is stuff out there for them.
Wonderful. There was another question, actually someone else asked, that was my question about loss, but someone else asked a question about resources that are available to support families experiencing loss. So I wasn't the only one that had that question. Then there's a question about what are some of the best bonding activities? And I'm assuming that's for parents and their NICU infants or families.
My best bonding experience was kangaroo time, also known as skin to skin. And that's when you have your shirt off and you place your baby right on your chest. And that was like the best experience ever, my first kangaroo time. And also I would read to him every time I came, just many, many books, read.
Oh, that is fantastic.
I would echo that. I would say that people say that all, the stress and anxiety all melts away the moment you can get that baby on your chest. So really, you talk about, supporting the caregivers and taking time away. You really need those wins and those times and those good things to focus on when you're in the NICU for sure too.
Yeah, and I think just to add to that, I think we're really starting to realize that the preferred locus of care should be on mom or dad rather than in an incubator. And that's something that's really kind of getting a lot of traction within our field now.
And you say that because it's not just benefits to the parents feeling good about holding their baby, but it also has benefits for the baby, correct?
Definitely, Kiba. We know that there are studies that show decrease in apnea, so the breath holding spells that preterm babies have, decrease in infection rates, and improvement in feeding tolerance. Just for the baby, plus all the additional benefits for moms and dads, certainly.
I would say it used to be the culture of wait till the baby is stable. Okay, now we can do skin to skin. Now I try to flip that. Okay, the baby's breathing too fast or the baby is having multiple T-sets. Where is the parent? Let's do some skin to skin. So really even flipping that culture that really, can have these babies do so well.
Wonderful. There's some more questions coming in. Can you talk more about how birthing partners, spouses, et cetera, can best support mom and baby during this difficult time? I'm going to put you on the spot, Carissa.
Carissa, I was going to say, Carissa, I have what I think, but I think Carissa.
How can people help mom during this very challenging time, particularly partners, spouses, or
as you need to lean on each other because the mother is experiencing her own emotions, the father is experiencing his emotions as well. So it's a tough battle and you guys have to lean on each other. It's going to be extremely hard, but you have to.
That's true. And it's important to have a support person of some sort. I know we talk a lot about, partners, but there may not be a partner in the picture, but having some sort of support to go through this process is really, really important.
I will say men and women often process it very differently too. So just the kind of awareness of, what your partner may or may not be feeling, sometimes you feel, okay, you're not acting like I am in this moment or whatever. So just that awareness there that they're just different and they're going to go through this differently than you. So to be there for each other and kind of, sometimes that ebbs and flows sometimes when one support person is doing good and the other isn't, and you kind of go with it and take it day by day.
Absolutely. And so there's one more question. Actually, there are a couple more questions. One is for Lauren. Can you give your biggest piece of advice to students who are considering nursing school?
Yeah, I think if you're considering nursing school, I really think my biggest piece of advice is it's going to be hard. It's going to be really tough, but just remember what you're doing it for. And remember what the end goal is. You're going out there to be a nurse. You're going out there to support and care for others and to be there in sometimes people's darkest moments. And I think being a nurse in itself is just such a heroic and empowering job. And I think to be able to go through nursing school with that in mind is something that can really help you out.
Thank you so much, Lauren. And then our final question I'm going to take for this session is, can you share about how professional education on family-centered care and patient experience help influence the culture of the NICU and the care that families receive?
Yeah, I'll take a quick stab at that, but I definitely may need to phone a friend. We're learning more and more about the important roles of families, and in education is coming, slow and steady. We are learning more and more about trauma-informed care. So a lot about, the specific traumas that our families are feeling. We may not see it by having a sick relative, or in this case, a sick infant in the hospital, and a lot of the emotional support that the families need. Family-centered care, luckily, March of Dimes provides an immense amount of education around it. And we know that the improving family-centered care is really at the hallmark of any NICU. You can't have, if you want to be a great NICU, if you want to be an exceptional NICU, you have to really, as we say, take it to an 11 on family-centered care. You have to do that, and that has to be your mission. And if that's the true north of your NICU, you're going to have a fantastic NICU, and the families are going to have a fantastic experience. So the center of the NICU, in the center of everything we do, is the baby and the family. And as long as that's kept in the center of your work every day, you're going to have good outcomes.
That's fantastic. All right, no other comments on that question?
No, I love it. That's exactly what I would answer. I would just say that, making family-centered care and education in the NICU for your staff, I mean, it just, it shows that it's a priority on your unit, which I think is what Dr. Piccarillo is getting at, is that, it shows that this is who we are, and this is, what our priorities are. And then it just opens up conversation, and, it helps people realize how important it is to the outcome, just as much as, any other clinical experience is, and helps us get to where we want to be for our families. And to see Lauren sitting up here one day going to nursing school and taking the baton from me.
I think that is so beautiful. Lauren, I just love your story. It just makes my heart just so full to see just the journey from being a NICU baby to actually serving in a NICU someday. So thank you so much to all of you for being with us today. I just want to thank also everyone for joining today's webinar. We are happy that there's so many people aligned with March of Dimes and its commitment to a country of healthy moms and strong babies. We hope that we were able to answer all of your questions today. And for those of you who are tuned in, we'd love it if you would follow March of Dimes on our social channels and thank a NICU nurse on our wall of thanks. As we prepare to close out the webinar, I would also like to thank Cigna for their support of this webinar. And I'd like to thank all of our amazing panelists for being with us today. We know that there was a lot of information shared on today's webinar, so we have a prepared list of resources for your reference. You can take a look at these various links that are presented for much of the information that was shared today. We just want to thank you so much, and especially want to thank all of our neonatal nurses and neonatal care providers during this special week as we also celebrate our 20th anniversary for our NICU Family Support Program. Thank you again for joining us.